as a clinician scientist, you're often thinking while you're talking to the patient about the basic biology that underpins their disease. And similarly, when you're in the lab, one is thinking about what that really might mean for a patient.
Quite a lot had been done in the area of blood cancers and leukaemia, but very little was known about the normal steps in mammary gland development. And you really need that as a prerequisite to understand how cells are transforming into breast cancer cells. The Victorian Breast Cancer Research Consortium really turbocharged breast cancer research in Victoria.
Finding that we could decipher how these cells were switched on and switched off and what the role of female hormones were, and then identifying the culprit cells which give rise to cancers in women who carry a faulty BRCA1 gene. It's really the transition from basic research and those sort of milestone discoveries that we can see have a potential role in the clinic, which are really exciting for us.
We first identified the breast stem cell, and then a year later we identified the luminal daughter cell. And this has provided a really important framework for us to understand the cells in breast tissue, the normal cells in breast tissue that go awry and have this sort of propensity to become cancerous. We use this information to actually pinpoint the cells that go awry in BRCA1 mutation carrier tissue. So this was a very exciting finding, and it's even gone to a small clinical trial.
The work that we and others have done in this area have provided a new framework in which to understand how breast cancer develops. The Victorian Cancer Biobank was something that I was lucky enough to help contribute to the establishment of, and it's really helped fuel research.
We have a particular interest at the moment in deconvoluting the cells at a single cell level in both normal breast tissue and breast cancers, in particular triple negative breast cancers, because there are very few therapeutic options available to these women besides chemotherapy.
Jane and I have been really fortunate to be collaborating over this long period of time and bringing our different skill sets to this. But it's actually much more than that. It's an extended team of people that have been very passionate about the research that they and we have been doing.
Collaborations are pivotal because it helps you tackle tough questions and get there a little bit faster.
As new discoveries are made, Victorians tend to be the first to benefit from those discoveries if they're homegrown discoveries. So I think that's a very important and often understated aspect of what can be delivered to the healthcare sector.
I'm Professor Jane Visvader from the Walter and Eliza Hall Institute.
And I'm Professor Geoff Lindeman from the Walter and Eliza Hall Institute.
And we're very honoured to receive the 2017 Victoria Prize for Science and Innovation
in the Life Sciences.